Hello there, my name is Dr. Rosemonda Boaje, and today I want to talk about the prostate gland and the conditions that can affect the prostate gland, the very common ones. And so today is our Men's Day. Yay! Okay, so what is the prostate gland? The prostate gland is a very small gland. It's about the size of a tennis ball, and it's found in all men. It is found between the base of the penis and the rectum, in between there, somewhere deep down in your groin. And it sits at the base of the bladder. Okay, it sits at the base of the urinary bladder. And the unique thing about the prostate gland that makes it problematic is that it surrounds the urethra, part of the urethra. So your urethra is that tube through which your urine will pass before it comes outside, okay? And there's a part of the urethra, the prostatic urethra, it goes through the prostate gland. And because of that location, that's a real estate, the very important real estate called the prostatic urethra. That is why the prostate gives a lot of men problems. So what does the prostate gland do? The prostate gland produces part of the seminal fluid in which your sperms would swim. And the seminal fluid is important to nourish and to protect and to transmit sperm. And so for every man, the prostate gland is an important part of your reproductive system. What happens when you have benign enlargement of the prostate, what we call BPH, or prostate enlargement, which is our first condition we are going to talk about, is that the prostate becomes big, and because it surrounds the urethra, it compresses on the urethra and blocks it, so that when you are passing urine, the place is blocked and it is more difficult for you to get the urine out. And on that note, I'll come to the symptoms of benign enlargement of the prostate. When your prostate is enlarged, one of the signs you notice is that when you are passing urine, you have to strain hard before the urine will come. Okay? You strain very hard. The other thing you might notice is that when you are younger, if you are urinating, say 2 meters, 3 meters from your feet. But when your prostate is big and it is compressing on your urethra, when you are urinating, it has a very weak or poor stream. When you urinate, it lands right by your feet. It doesn't go far. The other thing is that when your prostate is big and it is pressing your prostatic urethra, when you urinate, because it's so hard to get the urine out, most of the time you are not able to get all of the urine out. Then you feel you are okay. So consistently you have urine in your bladder. And so after you have peed, you feel like there's some of the urine left. That is what we call a feeling of incomplete emptying of the bladder. And because of that, it doesn't take very long, you feel like peeing again. And so every 30 minutes, you have to go to the washroom. It is because it is very difficult for the urine to come out. And each time you go, you just get a little out. So it doesn't take very long. Then you feel like weeing again. And that is what we call frequency. And because the urine is sitting in your bladder for a long time, you know how when you keep water in one place and you don't empty the container, you don't change the water, it starts to smell. That's the same thing with the urine. When the urine stays in the bladder for a long time, every time there's urine sitting in the bladder, you get infection in your urine, what we call a urinary tract infection, and that will worsen your frequency. So every few minutes you want to go and pee, and in addition, other times, when you feel like going to pee, you have to hurry up, otherwise go home. And now say, oh, the hona, Johnsona, it's coming from your penis, the tip of your penis. We call that overflow incontinence. There's a bladder now, you don't even feel that you have to go and urinate, and then it is just overflowing by itself. So these are some of the common signs that you find when your prostate is enlarged. A hard dreamer, it worries a lot, because for a lot of men with enlarged prostate, they don't get a good night's sleep. The urine keeps waking you up at night. Every 2 hours you have to wake up and come and empty your bladder. But the good thing is that benign enlargement of the prostate can be managed. It can be treated. First of all, you need an abdominopelvic ultrasound scan. We'll look at the prostate gland. We'll measure the size or the volume. We'll be able to tell your doctor how big your prostate is, whether it is projecting into the bladder base. That gives an indication of how bad the prostate enlargement is, or how bad its effect on your prostatic urethra. Then the other thing we'll tell your doctor is how much urine you have left in your bladder after you have urinated. So you notice that when you come to run and we check your prostate, after that we let you go and pee, especially if you are past the age of 40 years. You come back again, we take a look at how much urine you have left. Then we tell your doctor that, oh, you are able to empty your bladder well. Or no, after you have peed, there is a lot of urine left in your bladder. The next thing you need to do after you have checked the size of your prostate using an abdominopelvic scan is to do a test we call a PSA. It is a blood test, and it measures the level of a hormone that the prostate produces, the prostate specific antigen. So this blood test will tell us the level of PSA, whether it is normal or whether it is high. And depending on how high it is, we may be worried for benign enlargement, we may be worried for infection, or we may be worried for prostate cancer. When it comes to infection in the prostate, which we call prostatitis, it is much more common in younger men. And typically you have most of the symptoms that I have described with the prostate enlargement. But in addition, particularly, you have a lot of pain when you are urinating. Your urine may be cloudy. Clear. I say, cloudy, white, kakra. And then also you may have blood in your urine. You may have blood in your both for prostate enlargement and when you have prostate infection or prostatitis. With prostatitis or prostate infection, one of the other things that can happen is that you have fever. Your body temperature goes up. You may have rigors and chills, or like when you have malaria or any kind of infection. So these are the things that you can see when you have a prostate infection, and that can be very easily managed with antibiotics. How do you prevent prostatitis? You need to manage your hygiene very well. A lot of the time it is poor hygiene, or sometimes you are having unprotected sex with very questionable vessels. And that brings us to our last item on the list of prostate diseases, which is prostate cancer. And so one of the things that makes prostate cancer dangerous is that for a lot of people, you may not have any symptoms at all. The first time you have a symptom, it has spread somewhere, and that is the one causing you a problem. What is prostate cancer? Prostate cancer is cancer that happens in your prostate gland. And we know you have prostate cancer when we measure the PSA and it is very high, beyond a particular threshold. If you have prostate cancer, your prostate gland may have a normal size. It may be enlarged, and we can check that with an abdominopelvic ultrasound scan. We also check how much urine you have left after you have urinated, just like we do for prostate enlargement. And for prostate cancer, there are a few risk factors that you need to take note of. Increasing age. As a man grows older, the chances that you get prostate cancer is very high. In fact, by the time most men get to 70, 80, a large percentage of men have prostate cancer, even without knowing it, because like I said, it is asymptomatic. It shows no signs in a lot of people, and you may die from other conditions or other situations even before we are able to detect that you have prostate cancer. The other risk factor to note is race. Prostate cancer is very common in the Black or Negroid population. And so if you are like me, if you are of African descent, you are a man, you are in your 40s and upwards, it is important that regularly, annually, you check your PSA level so that per chance it starts to go up, you are able to identify and take steps to find out why your PSA level is going up. The last but not the least, when it comes to the risk factors I want to talk about today, is family history. And so if you are a man out there, you are watching me, and you have a relative, a dad, an uncle, a brother, somebody close to you who has had prostate cancer, your chances of getting prostate cancer is higher than the average man. And so you need to be particularly very diligent in checking your PSA level, in checking the size of your prostate gland. Early detection of most of these cancers, including prostate cancer, makes a lot of difference in how we are able to manage you, how much time we are able to buy for you, and how well you do after the diagnosis. Walk into Rand Medical Imaging and Health Systems. Have your PSA level checked. Have the size of your prostate gland checked, and let us have a conversation with you as to the next steps to take if we think that you are at risk of prostate disease. Thank you, and God bless you.